All right. My name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Science at Boise State University. It's with great pleasure that I introduce this afternoon Stephen Glass from University of Western States, a chiropractic program near here in Oregon. And I'm going to let him take it away and give you some brief information, and then we'll have some time for question and answer.
Thank you, Erin. Hello, everyone. My name is Stephen Glass. I'm with the University of Western States. I advise for the Doctor of Chiropractic program, as well as the Master of Science in Sports Medicine program we have. And I really appreciate the opportunity to speak with you, and know I'm available, if need be, to answer questions that you might have after this info session. All right, so well, let's see here. We got a little glitch. Got it. Okay, there we go. Oops. Sorry. All right. So the University of Western States was started in 1904 and is the second oldest chiropractic program in the country. And it's gone through the decades. It's gone through a number of iterations. But in 2010, we became the University of Western States. And at that point, we introduced additional master's and doctoral programs to our lineup. Although the Doctor of Chiropractic is still our primary on-campus program. In 2020, we moved to a brand new campus in Portland, Oregon. It doubled our clinical space, and it's just a brand new, beautiful building with great infrastructure, and we're really excited to be there. Now, some of the other programs that we offer at the University of Western States, in addition to the Doctor of Chiropractic program, are master's and doctoral programs in sports medicine, human nutrition and functional medicine, sports and performance psychology, clinical mental health counseling, and clinical nutrition. And starting in the fall of 2023, we are introducing a naturopathic doctor program as well. Now, the Doctor of Chiropractic program is still our primary flagship program, if you will. It is currently our only on-campus program. And that will change with the nutritional Doctor of Nutrition program in the fall of 2023. However, I'd like to draw your attention to the Master of Science in Sports Medicine program. If you have interest in sports medicine and you would like to include it with your chiropractic education, it is a great program to do so here at the university. Many students opt to take the program concurrently because that 23 of the credits of the Master of Science in Sports Medicine program are duly attributed from the chiropractic program. And the instruction for the sports medicine program is hybrid, where you have in-person laboratories, but all the lectures are online. So students are able to complete their Master of Science in Sports Medicine at the time that they complete their Doctor of Chiropractic. So it's a really good option for people who have interest in working with sports teams or would just like to broaden the scope of what they can offer in a clinic that they may have in the future. Now, what is a chiropractor? Well, many of you know, but essentially chiropractors are a portal of entry physicians trained in conservative, least invasive methods of care. This includes therapeutic techniques, manipulations or adjustments of the body, as you'd expect, soft tissue therapies, physical therapies, rehabilitation techniques, nutrition and lifestyle recommendations. Now, when weighing, when weighing a career, many people choose chiropractic because they want to make an immediate difference in the lives of their communities while also enjoying shorter training periods, lower malpractice insurance, the potential to be self-employed, and the opportunity to work in less stressful environments when compared to some other healthcare professionals. Now, the Doctor of Chiropractic program at UWS teaches students how to diagnose and treat the whole patient. I mean, that's really fundamental in our curriculum. The curriculum is very science-based, and focuses on evidence in the evaluation and care of patients and their needs. Now, the program, oops, I think I missed the slide there. Oh, no. Overall, I think one noteworthy item with the curriculum at the University of Western States is Oregon has the second broadest scope of practice for chiropractors here in the US. And essentially that broad scope of practice makes its way into the curriculum. So UWS teaches to this broad scope, which includes extremity adjusting, nutritional advice, exercise therapies, obstetrics, and even minor surgery. Now, because of this broad scope of education that you will receive at the University of Western States, you will be trained and meet all other state and province requirements. Now, the program specifically, it is a 12-term program. Now, we are on the quarter academic calendar, and so the program is intended to be completed in 3 years. So it is quite rigorous in that regard. Currently, we have two starts annually to the program. Again, being on the academic calendar, we have the fall, a fall start, and then we have the winter start as well. You can see that would be in October and January starts. Now, the program is rigorous, being that it's going to be completed in 3 years. So you should expect to be in courses in class roughly from 7:30 to 5:30, of course, not the whole day, but you expect about 35 hours a week of on-campus engagement. And you do start hands-on type laboratory classes of the first quarter with palpation, and then you get into adjusting classes in the third quarter. Some of the highlights, as we'll look at here shortly, chiropractic programs don't require bachelor's degrees to start them, although some states do require that a chiropractor has a bachelor's degree. So one facet of the program is that you have the opportunity to apply and earn a Bachelor of Science in Human Biology after the 5th quarter of the 12 quarters in the program. And essentially, even if you have a bachelor's degree, that is something that you can apply for and receive. We also, as I mentioned, the concurrent Master of Science in Sports Medicine, we do have another program that is an option that some students opt to take, and that is a Master of Science in Human Nutrition and Functional Medicine. Now, that program does not have any concurrent coursework, but it is a program that can be taken online during the chiropractic program. Now, the clinical experience at the University of Western States. Although the clinical sciences do start much earlier in the program, students actually start working with the general public in quarter 8 on the campus health clinic. And then starting quarter 10, students become eligible for a whole number of community-based internships. And then additionally, quarter 12 is a preceptorship. And that preceptorship can be completed outside of the Portland area. So it is not uncommon for students to return to their hometown or towns that they may want to practice in to complete the program. Now, in terms of admissions requirements, I'll start with the academics here. There are two broad facets to the academic requirements. The Council on Chiropractic Education, they accredit chiropractic programs here in the US. They have a broad set of credit-based requirements for to enter a program. And then each institution, such as the University of Western States, will have their own set of prerequisites within those broader credit requirements. So broadly speaking, what is going to be required is 90 semester credits of undergraduate coursework. Again, a bachelor's degree is not required to start a chiropractic program. Now, within those 90 semester credits, there are 24 semester credits of life and physical sciences required, half of which need to have a laboratory component. So again, that's the broad-based credit-based requirements that the CCE requires. Now, here at the University of Western States, we do have some prerequisites within those sciences that are required. We require 3 semester credits of general chemistry, and really that can be a 100-level class or up. We also require 6 semester credits of human anatomy and physiology. So really what you're looking at is 1 class in chemistry and 2 courses in human anatomy and physiology. Now, there are some suitable substitutes for human anatomy and physiology, which as an advisor, I would be able to look at your transcripts and assess if there are some that you've taken that might work, such as exercise physiology, very common for kinesiology majors. Now, it is a very science-forward and heavy program. So we do recommend coursework in physics, biology, organic, or biochemistry, just to better prepare you for those rigors. Although they're not required, they are highly recommended. Now, if you are interested, and above and beyond the academics, we do, as you would expect, have other application requirements. There are 2 essays that you will encounter. They're brief. Expected word count with these essays are going to be 200 to 500 words. One essay is going to ask you about your career goals. Essentially, what are your goals and how can UWS help you achieve them? The second essay is going to ask you about any extracurricular activities or volunteering that you've been in and involved in, and how they've resonated with you, what you've really learned from those experiences. A resume or a CV is required, and we do require 2 professional letters of recommendation. Now, those can be professional-based or academic-based. They can come from supervisors, professors, coaches. The admissions committee would like to hear from someone who can speak to your character and your work habits, as you might expect with a letter of recommendation. Official transcripts to any undergraduate institution you've attended will be required. And that would include even a single course that was taken at a community college, for instance. And there is a personal interview as part of the application process. The personal interview is a second phase of the application process. But essentially, you will meet with someone who from the admissions committee that like to just get to know you. I want to make sure that the University of Western States is a good fit for you and that you're a good fit for the university. And there is a $50 application fee. And in terms of when you should apply, typically what you'll find is that the application deadlines are going to be about, I'll say 2 months prior to any start that you're interested in. However, we do recommend that one applies 6 months to 1 year in advance of their desired start. Really, that additional time just allows someone to ensure that they have all the prerequisite courses completed, allows time to plan for a move, and just really just ensure, by applying early, you'll be assured of that spot and just really motivated to start the program. Now, we are a regionally accredited institution, and as such, when you receive your conditional acceptance, you can apply for federal support through the FAFSA system. And I do have the school's code here, but you're always welcome to reach out to the University of Western States Financial Aid Department at finaid@uws.edu, or you're welcome to give them a call at 503-847-2563. And we're based here in Portland, Oregon. Being from Oregon myself, I can't speak highly enough about the area. Portland is a great community. We have great sporting events, great restaurants, parks, very livable, walkable city. If you like the outdoors, I can't speak highly enough of that. We're an hour from the Oregon coast, an hour from Mount Hood, a couple hours from the desert. So there are ample opportunities to get out and enjoy the great state of Oregon. And that's what I've got. How about any questions that you might have?
Can you talk about the program, about how many applications do you receive in a given cycle?
Oh, that's a great question. So, for instance, in the fall cycle, we will receive upwards of 250 applications, but not all of those that's started applications. In terms of applications that are completed and roll through the admissions process, we're going to be looking at about 175. And our starting class in the fall typically will be about 120 students.
Okay.
Any other questions?
What makes your program special?
Well, I think, we're one of the only schools in the Northwest, so location can't be overlooked. It is a fabulous location, but I really think our approach to chiropractic education, in that it's really science-based, evidence-informed approach to chiropractic care. Additionally, the broad scope of practice in Oregon really allows for deeper dives into other modalities and sort of facets of patient care, such as nutrition and lifestyle, for instance, recommendations.
Okay.
Anything else?
When you've worked with your students and you've admitted them and they're now participating in the program, what would you say is the number one thing they wish they would have known before they started?
Oh, that's a great question. I think the one thing that they wish they would have known is that it is a rigorous program, and that maybe having that foundation in organic or biochemistry would have been beneficial. So just sort of, even though we have a set of prerequisites, a little deeper dive coming in with some of the harder, sort of higher level science type courses.
Okay. In terms of support for students while they're going through the program, what kinds of things do you do to support students so that they're successful?
We have, well, first of all, the faculty, staff, the whole community at the University of Western States is really supportive. And that's from the president's office all the way down to facilities. But the Student Services Department at the University of Western States offers many, many great resources for incoming students. We have, excuse me, we have great academic support. So that would be in the form of free tutoring for all topics. We have support, academic coaching. There's free counseling for students, testing accommodations. So really, student services is going to be the hub of all student support. But again, broad, a little bit broader in scope is just the community, and I can't speak to it enough. There's great support within the community.
Shannon, if you don't jump in, I'm going to keep going.
I missed part of the presentation, so I'm like, oh no.
Okay, so would you say that a student who has a bachelor's degree already might have a better chance of getting accepted to your program, or does that carry any weight?
If one is satisfied the academic requirements, they'll have a solid chance of, academically speaking, they're going to have as solid of a chance as someone who has a bachelor's degree when they enter the program. The admissions process is really, and what in terms of looking at applicants, really taken in a very holistic manner. So the academic component's one part of it, and certainly solid academic background is going to be a primary focus of admissions, but the essays that are composed is going to be important. So good, high quality essays, solid letters of recommendation, and just being really, being passionate about it. So when whether it's reflected in the essays or the interview, just really being sure that this is the correct path, I think, is going to be as important as whether you have a bachelor's degree or have just sort of satisfied the bare minimum academic requirement.
Okay.
What are the demographics? Sorry, for people in the chiropractor program. Sorry.
Yeah, I think, overall, demographically, we are just at about 50-50. I guess you could say gender split. We have, age-wise, our average age is going to be 25 to 30. I think it pins right at 28. Although we see students from a lot of different non-traditional backgrounds. So there's certainly students in their 40s. And then we have a few very eager, very successful young students that have come in who prior to that in their early 20s. So really our demographics are going to be split down the middle in a lot of ways, and age-wise be about in that sort of later 20s.
So if you have a student that's like a smaller female and maybe not as strong, are they still successful?
Absolutely. That, certainly one thing I would always want to do is connect someone who's unsure about the program and maybe due to size with some of our student ambassadors. We have a great group of student ambassadors of all different sizes, and they will speak to their experience in the program. But with the someone who's smaller in stature will be successful in the program. We have it's very technique driven, so they're going to learn all the techniques to be able to really manage adjustments as someone who might be on the smaller sides of things. And then the equipment that we have at the University of Western States, we have brand new furniture throughout the building, new state-of-the-art adjusting tables. And so it really allows for to really support anyone's educational journey, regardless of their size. That's a good question. Never been asked that, actually.
Thanks. So I have another question. This might be stupid. So I'm an academic advisor. And so when I think chiropractor, I also think PT, and I think they're a lot the same, but chiropractor seems to require more science. Why is that?
That's a good question. I'll preface this with saying I'm relatively new here and I'm still getting my footing. So that might be a great question for like one of our faculty members or the deans of the College of Chiropractic, which are always happy to speak with prospective students. But there's a fairly strong physiological component to chiropractic care and neurologic. And so I think maybe that's likely the basis for the strong science background, but I guess I don't want to say much more because I don't know. Is probably the better answer.
Yeah, I'm in the same boat you are with the bean.
Okay. But no. I have great resources on this end, so I'm happy to connect someone if they would like to dig deeper there.
So this might be one of those too, but
sure.
So in my experience, and I've been doing this quite a while, the chiropractic schools have a spectrum of how they teach their curriculum in terms of maybe they're balanced between a very, staunch like chiropractic background, belief and style and approach to medicine versus a more interprofessional, more bringing in some of those allopathic, osteopathic kind of components. Where do you feel Western States might sit?
I would say that we skew very far towards the latter. We really take you kind of approach chiropractic care in a functional medicine sort of lens, really getting to the root of the problem, and focus on treating as sort of really treating the whole person. The scope of practice in Oregon does lend itself to that because chiropractic physicians here in Oregon, sometimes with some additional training, but they can counsel on nutrition. There's obstetrics component, again, with some additional training, but it's really taking a functional medicine approach to chiropractic care. So certainly departs from more the traditional, what I might call traditional, very philosophical approach to chiropractic care.
Well, and it looks like you, with the new additions to your other programs, that they might get some support to kind of have some extra components, maybe, like have the ability to do like some ultrasound and some of those things that like play into supporting the patient as a whole. So
yeah, the radiology component in the curriculum is pretty pronounced, but yeah, it is fair to say that because we have additional programs that we offer, that makes its way into the program. That's sort of, we have good, deep background. Well, our faculty has very extensive background in lots of different, I guess, modalities. And
great.
yeah.
Okay.
Anything
Other
else?
questions, Shannon? You've had some great questions, Shannon. I don't know what you're talking about.
So, okay, this one might be stupid too, but so there's kind of a stigmatism that comes with chiropractic medicine, and a lot of people think it's like not real. How would you recommend that we talk to students about chiropractic to encourage them to go that way?
That's
Sorry.
yeah, that's a great question. You know, I think chiropractic care isn't at the University of Western States isn't just adjusting adjusting the back essentially, or the neck. It's really a lifestyle coaching in a lot of ways. And certainly there is a component of chiropractic. I mean, it's a chiropractic university or program, but depending on the chiropractor chosen, it can be so much more. And at the University of Western States, it's much broader in its scope. So as a portal of entry physician, someone can go see a chiropractor that maybe has some aches and pains, and they can get to the bottom of what is actually going on, and then be coached and on ways to treat that issue that may be beyond the back pain. But that is, yeah, I mean, that's something that I often doesn't come up in my conversations. So, and again, sort of my limited experience is probably the best that I can answer with that. That if there's an interest, I think I could be happy to follow up with you, but I think speaking with our faculty would be a good one on that one.
Oh,
sorry.
cool.
All right. Well, I'm going to stop the recording.
Okay.